How can I trust my heart again? That's a common question I get from patients. Lauren Greene is an exercise physiologist, and she has committed her career to helping patients regain their strength after a cardiac event. Cardiac rehabilitation is a great way for patients to learn about exercise, diet, and connection. I hope you enjoy my conversation with Lauren Greene. What is an exercise physiologist?
We have a degree in exercise phys or exercise science, and we have the education to understand how your body is going to change from your resting state to your exercise state. And in the clinical world, we understand the disease process that can occur and that can influence how everything looks, from your heart rate to your blood pressure to any EKG changes. We understand a lot of the lifestyle changes and the risk factors that go like hand in hand in increasing your functional capacity, and then that helps to reduce the risk of another heart event or the progression of heart disease.
What is cardiac rehabilitation or cardiac rehab?
Cardiac rehab is a multidisciplinary, supervised, medically prescribed exercise program for individuals after they've had a heart event, something being like a heart surgery, like bypass, angioplasty or stent, any valve surgery, or if they have chronic heart failure. So their doctor refers them to cardiac rehab, and they come in for the supervised exercise where they'll work with an exercise physiologist like myself and a cardiac nurse, and we help them in their recovery to build back up their functional capacity so they can, do all those activities that they'd like to do throughout the day, and also help them address any lifestyle changes that they would like to make to help decrease the possibility of another heart event.
I've been facilitating a support group for over 12 years now, and many patients feel disheartened and worried because they can't get into cardiac rehab right away. Do you have any tips for them?
Well, that's improving. We've tried really hard to restructure our cardiac rehab program here at UCLA to really decrease that wait time. And right now, patients are waiting just about 2 or 3 weeks, and that tends to really match up with their recovery time of when some of those restrictions after the surgery have lifted. But in the meantime, while you are waiting, just starting with a light walking routine is the best thing to keep you moving. So just 5 or 10 minutes multiple times throughout the day. Every day, try to add on a minute or two so that you can walk 10 minutes continuously without getting out of breath or having any symptoms.
What are the risk factors that put a person at risk for heart disease?
So there are 2 different classifications of risk factors for coronary heart disease, and they're the non-modifiable and the modifiable risk factors. The non-modifiable are the ones that you cannot change, you can't do anything about. And unfortunately, those are your family history, your age, and being born male. The ones that you can change, that cardiac rehab is built on the foundation of, is managing your blood pressure, managing your cholesterol, exercising, not smoking, and obesity, and then managing your blood sugars if you're diabetic.
So what does that mean if you're male? What does that mean?
Yeah, just being born male increases the risk for heart disease. Men tend to develop heart disease a little earlier in life. Age becomes a risk factor for men at 45 years and older. Women are protected for about 10 more years, and their age becomes a risk factor at 55 years or older. The occurrence of heart disease in male, no matter what any other risk factors, is always going to be higher.
For women who love the men in our lives, what does that mean? At 45, should men start getting tested?
Well, things like managing your blood pressure, getting your cholesterol checked, paying attention to any of the signs and symptoms of heart disease would be really beneficial to listen to and never ignore. For men, it's actually a little easier because all the research was geared towards men in the beginning. So the classic signs and symptoms of, the chest pain and pressure, that's more of the go-to for men in heart disease. Women, sometimes they present a little more atypically. That's why we really have to focus on increasing the awareness and the education of women in heart disease, is because of those differences that haven't really been studied as intensely over the years, like for men.
After a heart event, so many patients ask me, how can I ever trust my heart again? Do you have any advice for them?
Definitely can take some time, but participating in a cardiac rehab where you have the days and the months and all those minutes where you're supervised and monitored and have given the individual guidelines to understand how your heart feels now, quote unquote, the new normal of how you're going to feel. And then while you're here in the program of starting to exercise on your own and having that time to increase your confidence is one of the best things that I've seen in the long run to feel more confident to do that again.
What are ways in which patients can improve their heart health?
Meeting the physical activity guidelines of increasing your aerobic exercise to a minimum of 3 to 5 days out of the week, building up to 30 minutes of continuous aerobic exercise. That's kind of the foundation of your exercise that you want to start with, as well as managing your blood pressure and your cholesterol, managing your stress, finding new ways to relax.
What can you advise patients that are looking to prevent heart disease?
So always listen to your body, always do what feels comfortable. Find an activity that you enjoy, that's comfortable, convenient. If you hate walking on a treadmill, don't buy a treadmill at home because it's going to turn into a clothes rack sooner or later. But just start off with what you can do. Even just 5-10 minutes is a good place, and then gradually build on that. Always check in with how your body's feeling. Make sure you can always complete a full sentence, or we call it the talk test. You should never feel out of breath or can't complete a full sentence. If you can sing a song, you might want to push your intensity a little bit more. But just starting out with the frequency goal of building up to most days out of the week, and then slowly increase your duration up to 30 minutes continuous to something that you would say is fairly light to somewhat hard.
So many people are working remotely now. What do you advise if they're sitting at their desk all day in their home? Do you have any tips for them?
Really just like breaking up the sitting to like standing for 1 to 2 minutes every hour has shown to reduce some of the risk of having a sedentary job, or just trying to do anything that is continuous for 10 minutes with that goal of like 10 minutes throughout the day, and then you meet your physical activity guideline.
I coined the phrase heartquake, or trauma of the heart, to try and take away the shame and blame around heart disease. What do you think of that word?
I like it. It's fun to say. It sticks in your head. It sounds like impactful, like, you know, we have all experienced these earthquakes and know how we feel before, during, and after all of them. So yeah, hopefully it helps women feel like, you know, there's a place for them, and that someone is, you know, approaching these events with them in mind.
Thanks for watching Heartquake Media. Make sure you check out our website and social media for more information on heart healthy living. And remember, wellness starts with the heart.